You hear?
There's look, now these bitches want to be on here.
Morning, everybody.
Morning.
Good morning.
Morning.
I'm glad to see people on here. I was concerned with the registration invite because I had gotten a few emails and I'm like, oh no, I hope everybody got it.
When I registered, I'll put my camera on. When I registered, I didn't see the link, so I had to register again. But I don't know if it missed in my email or something. But yeah, I had to register just a couple minutes ago.
Okay, that's good to know. I'll have to look into Teams and see what's going on there. How are you doing, Jennifer?
Doing well. Doing well. Yeah, going through all the farmers markets. It's been great.
That's exciting. We're excited to have you there and really helping us with Double Up and everything else. So
yeah, thank you so much.
Depending on how many people jump on here, we may do actual introductions. Shalice, if you think that works.
I think that'd be great.
Yeah. We'll wait a few more minutes. Because we got to also make sure our special guest is here. Everybody enjoying this weather? Before it gets hot again, but then it'll hopefully come back down into the 70s.
I wasn't sure if this was the fake fall, but I'll take it though.
Yeah, exactly. I feel like fall is never long enough. And so, yeah, if we can get an extended time of fall, I'm excited about that.
It's my favorite time of year.
Yeah.
I can wear my hair out. I can finally wear my real hair because it's not as hot as it was this summer. So, but I will say this though, these last couple of days have got my hair a little thicker, but not as thick as it would be if it was the regular summer. So I'm thankful for the fake fall.
Yes. I don't want to delay it too much. I just want to make sure that Miss Frieda gets on here as she's doing her presentation. But we can definitely kind of adjust the agenda. Actually, let me go ahead and share. Well, why don't we go ahead and, well, first of all, here's the agenda for today's Community of Practice. So welcome everybody. We'll just do some quick introductions and then provide some updates. We don't really have a whole lot of updates at this point, but we will go into some Q&A at the end as well. So any kind of assistance or resources that you all may be needing from IDOH, that we can provide that for you. And then just go over the next full Indiana Nutrition Incentive Network meeting. We did have to change that. And so we'll provide that updated date, and then also our next produce prescription community of practice, which will be in November. And then a quick action item that we'll be able to share our Food is Medicine landscape scan survey that we are ready to get out. So I'm excited to share about that. So let's go ahead. I'm going to stop sharing the screen just so everybody can see each other. But let's go ahead and go around and do some introductions. Do we want to just kind of popcorn around? Will that work? And I'll go ahead and start, and then I'll pass it over to Shalise. But I'm Michelle Shippey. I'm currently still doing some food as medicine work for the Division of Nutrition and Physical Activity here at IDOH. But my actual role now is the executive director with the Healthy Hoosiers Foundation. It is a 501c3 entity that sits within the agency to support be able to leverage private dollars, and at some point I'm hopeful to be able to do a presentation around what HHF is and how we actually support the agency. But food is medicine is my passion. Nutrition, food access, food, all of that is my passion. So I do continue to be a thought partner and just a subject matter at IDOH as well. Shalise, pass it over to you.
All right. Hello, everyone. My name is Shalise Lee, and I am the Nutrition Incentive Manager here. So I manage Double Up Indiana for the state with the support of 3 regional partners. And most recently, I've been added to the WIC. Actually, WIC has been added to our team. And so not WIC, commodities that are coming over from WIC. And so I'll be managing the EFNMP program, which Michelle may have an update here after this. But so I'll be doing a dual role with the Double Up and the summer WIC and senior program as well. But here to support Michelle today. And feel free to ask any questions in the chat. I'll be monitoring that. And yeah, thanks. I can pass it. I can pass it to Jennifer.
You go next. Oh, go ahead.
Okay, whoever.
Okay, I'll go. My name is Jennifer. I'm part of the Northwest Indiana Food Council, and I am one of the regional leads for the northern region for the Double Up Indiana program. And I will popcorn it to Jenny.
Why couldn't I get off of mute? Hi, everyone. I am Jenny Dorica, and I'm the data manager for the Food is Medicine program here at the state in the Division of Nutrition and Physical Activity. So excited to be here and always willing to have conversations or discussions about how I can help support from a data and evaluation side. And I will pass it over to Lindley.
Thanks, Jenny. Hi, all. My name is Lindley. I'm the Food and Health Policy Manager at IDOH. I work directly with Michelle, Shalise, and Jenny. My focus within the Food is Medicine framework, though, is all things policy and insurance. So staying up to date with, how other states are implementing food as medicine interventions, including things like nutrition incentive programs, how they're sort of aligning that with state Medicaid policies or how they're funding it, things of that nature. So all things sort of policy and sort of scaling per se. So I will popcorn Bethany.
Hello, thank you, Lindley. My name is Bethany Winger. I am the Public Health Projects Manager at the Howard County Health Department. So we've got Kokomo, Greentown, and Roucheville, and then, the other parts of the county. our health department within the last couple of years has partnered with our local Purdue Extension office, as well as our Minority Health Alliance and some other partners to develop and implement a food as medicine program. So we just started our third cohort last week of this class, and we are targeting adults with or at risk for type 2 diabetes who also experience food insecurity to do an 8 to 12 week diabetes education program, and we provide food boxes every single week of class. So I met with Michelle and Jenny last week to just kind of talk about how we can improve our program specifically with regard to the data collection and management process. And Michelle invited me to join this community practice. So that's why I'm here today and looking forward to meet all of you and just learn from what everyone else is doing in the field.
I'll go next. My name is Shamisky Gray. I am sitting in for Anna McIntyre with the YMCA. I am the community health coordinator for the Northeast District for the YMCA, as well as I teach the DPP classes, diabetes prevention classes for the YMCA. I'm currently have a RX produce class that's taking part on Saturdays from 9 to 10. We're in our 9th week. It's really good. I really like it. My participants are excited. It's a full class every Saturday, so I am sitting on this call to get the information that is given today, as well as just taking on some wisdom and information, getting the backside of, RX produce, and just happy to be here representing the YMCA this morning.
I can go. I'm Lauren Noob. I'm the VeggieRx coordinator with Parkview Health in Northeast Indiana. We are currently in Allen and 4 other rural counties. So our program is GusNIP funded through 2026 for both programs that we have, but we also have some IDOH funding and foundation funding through Parkview. So just excited to see what's next on the horizon for PPRs. And I will pass it over to Kaylee Canary.
Hi, my name is Kaylee Canary. Sorry, I am running around right now. I just got back from a marketing opportunity and presented to some providers in Kosciuszko County about VeggieRx. But Lauren mentioned that we are in some rural counties up in north central Indiana. So I run VeggieRx through Parkview Health at Wabash, Huntington, and Kosciuszko counties. So Lauren and I work very closely, and I'm looking forward to seeing what we chat about today.
I can go next. My name is Frances Evans. I am the Nutrition Incentive Project Director for the Marion County Public Health Department, and we coordinate and implement prescription programming in healthcare systems like Eskenazi, Community Health, Jane Pauley, and then we have our newest partner, the YMCA. So I work alongside with Shemesky and her classes, and it's been a real joy and a lot of fun to start onboarding with the YMCA as of late. Monica, you want to go next?
Yeah, thanks, Frances. Hi, everyone. My name is Monica Duffy, and I work at the Marion County Public Health Department, also a dietitian, and I work with Frances. So I am the Produce RX program specialist, and I kind of manage our partnership with Eskenazi Health for their Produce RX program. And see, I'm not sure who hasn't gone.
I can go real fast. Good morning, everyone. My name is Anna, and I work with Indiana Grown for Schools, but I'm housed at the Department of Health. I'm a value chain coordinator there. And so my main role is connecting local produce to schools to get more product into schools. But we work with K through 12 as well as ECEs. And we also do some before and after school stuff. So with YMCAs and Head Starts as well. And I think Virginia hopped on. Virginia, would you like to go?
Sure. Hi, everyone. Virginia Pleasant here, co-director of the Northwest Indiana Food Council, and we are administering Double Up with several farmers markets around the region and do a whole lot of other food as medicine type work in various buckets. I'm sure my team is already updated. I joined a little bit late though, and I'm not sure who to popcorn over to.
I think we got everybody. Thanks everybody. It's really amazing to hear the work that's happening and even just the expansion of a lot of this work. And our goal, since we've been revitalizing the Indiana Nutrition Incentive Network, has been to really be able to bring partners across the state together to network and learn from each other. This work is very complex, as you all probably know, and it's ever changing and evolving. And it's really exciting just to learn the various aspects of how people are implementing their programs, who they're getting their food from. And when it comes to evaluation, I think that's where the state really wants to support and start to collect as much of the same shared metrics as possible so that we can continue to inform our leaders and policymakers and, eventually get sustainable funding for this work. So lots and lots of things are going to continue to happen throughout the year, but I just really hope that, we can use this space to be able to share information, resources, network with each other, and be able to reach out and share contact information. But we're very excited. Hi, Miss Frieda. How are you?
Doing well. My apologies
Good.
for the lateness. My apology.
You are good. You are good. Sometimes technology, when it works, it's great. And when it doesn't, sometimes it's, we give grace. I want to go ahead and introduce our special guest. I'm going to go ahead to real quickly and share a slide here. All right. So Miss Frieda Graves is going to share about the work they are doing at Faith CDC to address chronic disease through their food as medicine work. So Frieda brings over 30 years of experience in the nursing field, along with 10 years of farm management experience as a master gardener. And she has been researching the food as medicine concept to help reverse health disparities and address food insecurity in the Northwest Indiana communities.
Bring me that stool.
And Frieda is married to Darren Graves and is a proud mother of Angela and Damon Graves, and she is a lifelong resident of Gary, Indiana. So welcome, Frieda. And did you want to share your screen?
That slide I sent over to you, do you guys have that? I can share mine and just have you do slide to slide. And I'm so sorry about yelling for my husband to bring me the stool to put the computer on. I did not have my mute on. It's been a day already.
Yeah, so I have the document you sent.
Yeah, if you could just share that, I can talk over that.
Okay. Let me go ahead and pull that up here. Hopefully it'll show up just fine. I think it was a PDF. Okay.
Good morning. While you're doing that, I'll introduce myself a little bit. As Michelle said, my name is Frieda Graves. I am the Faith CDC Director of Food as Medicine. We're doing 2 different projects. I'm also on the GusNIP Prescription Produce Project and the Food as Medicine Project, which we do medically tailored meals. We have a farm as well as doing the program. We have several initiatives that we're doing in the food justice, social economic justice, environmental justice, and health equity portion. I have been at this farming for 10 years, but as she previously stated, I was in nursing for 30 years. So that's what got me interested in food as medicine as I came to be a farmer, learning about the medications that were at on the farm itself, like the thyme is a natural antifungal, or oregano for respiratory system, and all those kind of things like that. But I didn't want to um, overlap with the medical providers. So that's why we created the footprint as food as medicine. We actually did some research before we even started this program. As we were doing our CSA boxes, we were asked our participants if we did something like this, a food as medicine program, we were able to get funding, would they eat some of the vegetables and some of the meals in the low carb, low sodium, low cholesterol way. And we did a study with the School of Spear from Indiana University, Bloomington, 3 years before we did this program, and 98 participants said yes, they would join the program. Somebody's office. So 98% of the participants said yes, they would join the program, but 2% said no because they would not know how to cook these particular things in the meal. So that's what we implemented: all the cooking demonstrations, the nutrition education, and the physician referrals in this program. So starting off on the first slide, it's improving health in Northwest Indiana through medically tailored meal, and that's the contents. It's showing you you can go to the second page. It's the food as medicine programs, and this was the health issues and challenges that we did our evidence-based data on, along with Indiana University School of Medicine and Gary, Indiana University Northwest School of Medicine. So it shows all about the improved knowledge and the healthier dietary habits and improved self-reported health metrics, reduce economic burden, and all those things are implemented in the program. But when we wrote the footprint of this program, we want to be in a way that not only the participants would understand, but the physician would understand. We wanted to make sure that we were hitting the diagnosis that we had at that time was cardiovascular disease, but we doing on a prescription produce box is cardiovascular disease, diabetes, and gastrointestinal disorders. And we're previously on one more program through the Lake County HFFI program, and that one is cardiovascular disease, diabetes, obesity, mental health, maternal health, and food insecurity. So all those things are within our program. But when we did the footprint of this program, as you can imagine, I wrote the scripts for the doctors. We don't work just with one doctor. We work with some of the programs I know work with just one agency. We want to do it so we were like a produce prescription Walgreens. So we go with HQFCs. We do medical private physicians. We are Methodist Hospital is one of our partners. So we want to get it out there to all the physicians, so all physicians would feel comfortable sending their participants to us. There is a lot of data on this, and believe me, on those slides that Michelle is showing. But believe me, I was on all those calls with Indiana University School of Medicine, and we went through all these things. But I can just talk over them and give you a better idea just by what we've been doing. The reason we have those slides is because we wanted to have evidence-based material. So when we went to, because our main goal is to go to advocate with legislation and advocacy and all those kind of things. And we're already speaking with some local government, but we think these programs are so imperative to have continuously, because if we look at the programs that we have had and the things that we have done, we've reached probably about now between the three programs about 600 people, where we need to reach 6,000. In Northwest Indiana on the heat map is the highest grade on the heat map. If you look at the food insecurity, we have the highest SVI scores around Indiana as far as our social vulnerability index, our kids that need school lunches, our kids that don't have breakfast, and all those kind of things. So those are all things we took into account when we wrote this program. But the biggest thing we took into account was the health disparities in the Black community. We are number one in diabetes. We're number one in heart disease, and we're not number one in obesity in our diverse community. So those things were all in mind when we wrote this program and we wrote the footprints. And you can leave it right there at that slide right there, because that's the one I'm going to refer to. It's showing the race and the ethnicity in our area. They're showing that we are, I can barely see that, but I'm going to make it bigger on my screen if I can. That they're showing the ethnicity in our community. And now we're just not, and the thing about it is we're in Gary, but this was all Northwest Indiana. So we want to make it clear that this is Gary. And the ethnicity and the thing, everything that we dealt with in this area as we did this was a lot of veterans, a lot of homeless veterans that live in the Ronners Village in Maryville, Indiana. So we were trying to reach all, but the biggest thing really I really wanted to do was make sure that we were following, we were working alongside the medical provider. We did not want to try where we overshadow and we know better about food as medicine. We don't want any medications. We didn't want to do any of the HIPAA thing. So when we put them into the program after we did our initial survey and asked all those questions, including the food insecurity questions, the medical, I can't, the vital signs, the hunger vital signs and all that kind of thing. We want to make sure that we were working alongside their physician. So we weren't trying, well, we know better than the physician or everything because we don't. So when we did it, when we put them into the program, once they were put in the computer, they went into a unique identifier code. We didn't call them by name. The code was, I'm the only one that saw the information because I am a CD certified and we have an IRB that we follow from Indiana University as well. So I wanted to make sure that once we did that, there was just a code and they got that code, that card to pick up their meals. And now the same process with the boxes. They got that coded card to pick up their boxes. So we wrote the prescription, we wrote the diagnosis, we wrote the focus, and we wrote a history. To physician, we put the one that's also on the participants to see if they want to join this program because the confidentiality and we get a consent from the participants. And they would take the prescription to their doctor themselves. And we gave them an overview of the program. You're on for 6 months, totally no cost to you. On the meal program, it was 7 meals a week, low cholesterol, low carb, low sodium, chef prepared by a certified chef. He came out of the hospital, so he knew all about the contraindications. If there were any dietary restrictions, no leafy green vegetables, no anything like that, we want to follow that to the T. Any allergies, you can't have fish or anything like that. We followed that to the T. The chef would do side meals for these people in a different area as to not contaminate the meals with the regular meals. So all that was taken into consideration when we were doing that. The nurse practitioner is our nutrition educationist, and she does that once a month. She does nutrition education classes, and she goes through a whole curriculum, but she brings the curriculum from up high, from we're using medical terminology, to right here where everybody can understand what's going on, how to read the labels, how the my plate, and all that. She does all that once a month, and those classes are really pretty packed. I mean, I was surprised myself that people were still coming out even when she was doing it in the wintertime. But people need this education and information. So all that was also put into this. That's with the improved knowledge, and you can see the numbers there of improved knowledge on the participants. You could go to the next slide. If I talk too fast, somebody raise their hand because I am a fast talker. And I tend to speed through everything that's in my brain at one time is coming out. So the healthier dietary habits were also just wonderful numbers. The numbers we got back, even the state of Indiana when they came and did their survey of us. They were surprised at what we got back from doing this. And this is our first 75 participants right here that we started with. So it talks about the healthier dietary habits, and go on to the next one. And when we did it, we want to make sure that each person, after they did their 6 months, the next cohort will be a unique. Everybody, we wanted unique individuals for each cohort. So we did not want to repeat. So once we did something, and it was hard because there were people that were absolutely asking to stay on. They were absolutely asking, somebody said, oh yeah. So they were absolutely asking, could they stay on for another 6 months? But we were saying, no, we have a waiting list. And once word got out, we truly, as Michelle knows, we truly had a waiting list. And we still have a waiting list for the program that's ending now. So you can go to the next slide, Michelle. So that was one of my main things. the food insecurity. As I said, we have high SVI scores and heat maps and food insecurity, where we helping people to be able to eat and afford groceries. So one of the things that I put on our discharge summary is where you able to reapply some of the funding to bills, extra food in your house, and all those kind of issues. And people were amazed at the amount that they were able to save and have more food in their homes and even pay bills and things like that. Because in my mindset, if you're stressed out from paying the bills, then that's affecting your mental health, which is affecting your blood pressure, which is affecting the whole thing. So I wanted people to be able to know we did something called a tray plate analysis that we would pay us out weekly. And it not only asked where you eat, did you eat 75% or 50% or whatever that you eat. It would ask questions like, why didn't you eat it? And then people, and as we did that, we put the oneness back on the participants, like I said, and the information just started coming in. They started writing. My doctor said my cholesterol is down 2 points. I've lost 7 pounds. I've lost 10 pounds. I've lost 8 pounds. My doctor took me off of one of my blood pressure medications. And I cannot tell you the amount of times we asked, did we got the question is, my doctor said, what am I doing differently? What am I doing differently? He's been treating me for all these years, and now he's seeing results. So what am I doing differently? So those are the things we'll be going to. You can go to the next one. That excited me more than anything when they told me those kind of things. We actually had someone that lost 100 pounds on the program. And then we have someone that lost 50 pounds. And we have someone lost 25 pounds. And I go up to the next. That's just kind of showing a box on the next slide. On the bottom of the next slide, showing what the produce box looked like as well. Now that chicken there, what we had to get from distributor, but now we have our own line of chicken. We have 40,000 chickens that we were able to procure, and we have a farmer that's raising them to 9 weeks old, and we have our own processing plant, and we are USDA certified. You can go to the next one. So these are the self, we did, like I said, they self-reported the metrics, and when they did that, I took that information and got it over to Indiana University School of Medicine, and they went through the data and they organized and analyzed, and that's where they came up with these numbers from. So the evidence-based thing is important. As a matter of fact, we are going with the American Health Association, HPHA, in November to present at that conference in Washington, D.C., this report and the things that were done in this area. I'm going to have you go down. That's the weight loss right there. That tells you the percentage of weight loss, how many people lost weight, even if it was 5 or 10 pounds. That's one thing that I think that was unique to this program, and I think that was great. By doing that tray plate analysis, I mean, we did it every week, weekly, continuously. We were able to gather data from the participants that they volunteered. We did not have to say we're crossing the HIPAA line. We're asking them for information. They were able to give us information on what happened with their weight loss, with their diet, with their physicians. So I'm just going to have you kind of go down to the bottom because it's so many pages, and I don't think everybody wants to see all that. I can send this report over to you, and if you can send it to everybody if they want to see it. But it'll take us all day if we go through all that. This is the factor of the participants that in the program. I probably need my glasses right now because I can't see anything but one line there. And those are just some data findings. So I'm going to just leave that to Michelle and present to you guys later. But 100% of our participants said that they would rejoin the program. That was one of the things that made me happy. We were at 100% on that on the post-discharge programs. We did a pre-survey, we did progress reports, we did tray plate analysis, and we did discharge summaries. And we ended up with 100% will rejoin the program. And as a matter of fact, we are going to go those are policy recommendations from Indiana University School of Medicine, and those will be on the reports as well. And those are really important to show us how we can even improve the program more. And we have added some of those things in to the new program. So those things, those recommendations, we take very seriously. And that's probably about the end of that report. But that is the general gist of the whole program. That right there. They get their script. I call it a produce script because I'm so used to the nursing things, but the doctors can call it what they want with the focus on the diagnosis. They take it to the physicians themselves. Now, some physicians have actually asked for the scripts and they're in their office. They have them in their office, and they're sending people over. They're still sending people over, even though this program is now defunct for the city of Gary and in Chicago, but we still have Lake County going. Um, right now, we're in the process of completing the Lake County meal program. We still get the 7 meals a week, and we're in the process of completing our produce prescription from GusNip. That will be done in December, and that is where they get the produce box every other week. Uh, Same process. We do have some of the participants that have diabetes, but the doctor has specifically put no renal. They have renal, so no potassium. So we take the tomatoes and potatoes and everything out. We do produce boxes, in other words. We do prescription boxes. We take the potatoes, tomatoes, everything that has the potassium out of the boxes. If the doctor specifies there's certain things that they can't have, they don't get that in their box. We follow that line. So we'll be completing that in December, and that's another on that side. That's another about 300 people. We'll have completed by the time we're done. Right now we're in the process, and we just completed a documentary that's going to be shown at Indiana University Northwest on October 16th. About food as medicine, and the stars of the show are the participants. They're the ones that out there giving their testimony and talking about what happened, and not me. I'm not even in it, thank goodness. The participants are in there. We have some doctors. The doctors are in there. We have the chef. The chef is in there. The nurse practitioner is in there. But we want the participants to show what can be done and working alongside physicians, not working against physicians, and working with all physicians. Because if you know, in the city of Gary, there's a lot of Methodist people, but there's other places. Miriam Healthcare, Community Health Net is a big one. Oak Street Health. So this is what the program is, and this is what we've been doing for the last 3 years now, three and a half years now, and that's where we're at. We're just about finished with the program, but so my heart is overwhelmed. For me, it's a faith thing, because of my belief in my religion, but I think God put the vision in our heart. But right now, it's I'm just so overwhelmed and so happy of what this program has done for people, and that's what I am. And thank you guys for listening.
Yeah, thank you so much, Miss Frieda. I'm really excited. You'll have to share that documentary with us. I think it is so important to be, human-centered impact, like having the patients there, and that is critical. And however way we can share that as well, because showing things like that can also be very good from a policy aspect, like, oh gosh, like being able to see the impact and from the perspective of a patient or participant. Yep, go ahead. I was going to open up for Q&A.
Yeah, we are working with some local representatives and in this area. Our state representative Reagan Hatcher and our state senator Mark Spencer, who produced our documentary. So we are working on some things, but I think it's so imperative for these areas. And I know the current atmosphere is not conducive to grants and things, but we're looking for funding in different ways as well, that we can continue these programs. That's all.
Absolutely. So it sounds like I'm going to open it for any questions that people have. So just to kind of summarize, it sounds like you've got a produce prescription program going on. You have your medically tailored meals program. I think also it would be great to maybe just to share how you all have went through the Food as Medicine Coalition's accelerator program, which is excellent. And then you're getting into the medically tailored groceries part then. Is that correct in regards to tailoring it, for example, for kidney disease?
Yeah, I mean, you could say groceries, because I call them boxes because we're doing the boxes right now, but we are in the process of opening up a food hub as well. So I've been exploring some insurance contracts and things along that nature, because there's only one code right now for those particular things. But yeah, we're doing that. And then we did go through the Food as Medicine Accelerator. That one was traveled to Boston, New York, and working with the community servings, and I forget the name of the other one. Right now, we're in the accreditation program,
Oh, great.
intense accreditation program. I learned a lot there about policy and insurance plans and your presentation of your programs to open it up to other possibilities. They had a lot that we don't have. Um, of outside funding different areas. Of course, they're one of them, God's hand, I can't remember, is New York. So of course they have a lot outside funding. And Boston had quite a bit of outside funding that they didn't have. So I learned a lot on how to explore the outside funding that's not a state or federal fund to continue your programs as well. It was so much that we learned that it's I can't even go into all of it because I'm kind of tired today, as I can say, but it was so much that we learned about different things that your kitchen, even your kitchen. I mean, we do HACCP, our chef that does HACCP rules anyway. And then, but learning about things that you have to do in your kitchen and things along that line, they were just wonderful. There's that's a wonderful. I'm trying to think is anything else and I miss. Oh, our fresh frozen facility. Um, that's one of the initiatives that we have with the Northwest Indiana Food Bank and feeding them, and that is up and running now. So that's producing flash frozen vegetables before they're as she watches them. She has to blend some of them and flash freeze them. We give 20% to the food bank every 2 weeks. And then we just met with the Hard Rock Casino for a possibility of doing something different. That way we can have, that might be some funding areas where we can maintain and sustain ourselves because that's what we're all looking for, to sustain and continue these programs.
There's a question in the chat from Jennifer is how were the participants able to retrieve the produce boxes and meals? Were they delivered or did participants pick them up?
It's a combination. We do
combination. Okay.
It's a combination. We do have some delivery. Also on the meals as well. We have some delivery. And when the majority of them pick them up. And then the thing about that is once they get that unique identifier card with the code, they can send anybody to pick it up as long as they have that card and they can mark them off. So it's a combination.
Very nice. Is that an option that they are provided then, let's say at like registration or something where they say, oh, we prefer it delivered or we want to pick it up?
Yes.
Okay.
They you know, usually they'll say, can you deliver it? Most of them say they'll pick it up, but some of them, you know, they can't get out their house. So we deliver it. And that's another thing I going on. We have to do some more training with our delivery drivers to show them the interaction of if they feel like it's something wrong at that place and all those kind of things. So that Food is Medicine Coalition was fantastic in teaching those kind of things. So yeah, we're doing training with our delivery drivers to get them orbed.
Excellent. And what would you find maybe as far as challenges go? And then, you know, how did you address them maybe?
Our first challenge was reaching the physicians because physicians are very territorial to let them know that we're not just if we're working with Methodist Hospital, we're not trying to give their patients to Methodist Hospital, or we're not trying to give their patients to anybody. This once I got out and hit the ground and started going to meetings at physician offices, and that opened up. That was one of the biggest hurdles to get over, was getting there at the physician's office and letting them know we're not looking to give their patient a doctor so and so or anything like that. So once they got to gaining that trust, once they gain that trust that we're just trying to do this program for any participants that you want to put in it. We're not trying to give cardiologist to cardiologist. Then that was one of the hurdles. And then I had to have meetings with the leadership team at Methodist hospitals and things of that nature. Once we got past that point and the physicians started trusting and seeing their patients come back and is it going to work? But once they started seeing their patients, they could call them patients, I call them participants, come back and their blood pressures are lowered or they're losing weight and things like that, that helped a lot. And that, of course, that took a minute. And then one of the other challenges is when I was writing this thing, and I was writing this thing with the IRB and our representative from Gus Nip and the state, when I was writing this footprint, it looked great when you wrote the footprint. But when you rolled it out, there was so many, I had to go back and change like 80% of it. So that was a challenge, but once we got past it and it started flowing, But it was never a challenge once the doctors had an understanding getting participants. It was never a challenge there.
Excellent. Any other questions? Well, thank you again, Frieda. This is great. I will go ahead and send out that report document to everybody as well. And we'll make sure, and if there's anything else that you have that you want me to share out, feel free to send it my way and I'll make sure I include that as well.
Well, thank you. I'm sorry about the lateness. But
no, it worked out perfect. We did actual introductions as well. So it was nice to be able to do that because we had some new people on the call, which is always exciting. Well, I am just going to now share my screen again and jump to the last few items for the meeting today. Oops. We had to change our next Indiana Nutrition Incentive full network meeting to September 23rd. That invite should have, it's been updated. If for whatever reason you don't have it on your calendar and you want to attend, just let Shalice know and we can get you added there. That is sharing out our produce prescription evaluation report. And we'll have Limelight Analytics be a part of that conversation as well, who helped analyze the data from 2022 and 2023 when we had the health disparity dollars, and we piloted some produce prescription programs. So we'll go into a little bit more details in that presentation at the end of this month. And then our next community of practice meeting, this is a new proposed date. Lauren, I know I know you're on the call here. We did have it for November 11th, but that is Veterans Day, and there may be many of us that are off that day. So we have Parkview Health who's going to present on their Veggie RX program. And we could definitely find another date if the 18th doesn't work, but I just wanted to at least provide a proposed Tuesday when we'll have that one in November.
I'm pretty sure it works, Michelle.
Okay, excellent,
Yeah.
excellent. And then the last thing that I wanted to announce is that we are finally in a place to start collecting what is happening across our state when it comes to food as medicine. I have a document that I'm going to be sending out to everybody as well. So you'll get the link. The QR code is there if you wanted to scan it and forward it to yourself. We just want to make sure there's a number of ways to disseminate this out. The goal of this landscape scan survey is to first identify organizations who are doing interventions across the state. We have provided some definitions of particular interventions. If you are doing more than one, like Frieda, you guys are doing both medically tailored meals and produce prescriptions, you have to go back and do a second survey because we're doing them specifically for each intervention type. So if there's others that are doing more than just one program, or you are identifying more than just one program, you'll want to go back and do the survey a second time or a third time. But we really want to learn about the scope and operations of the interventions as well. What is the duration of programs? What is the dosage? Where's the food coming from? How long has your program been going on? How many have you reached since the start of your program? Are you evaluating? How are you evaluating? Who are your partners? I mean, it is all types of information that we're hoping to be able to just grasp the landscape and what's going on, and also addressing some of those challenges, but then also opportunities, so that we can move the needle in this space and be able to continue to really bring awareness and educate around the work that's happening across our state. And so, like I said, I'll go ahead and send, we have a specific document. Feel free to also forward it and share it on to other partners or stakeholders that you're aware of that are doing programming. And there may be some repeated ones that'll be shared with people, but that's okay. We really want to get it everywhere that we can to collect as much information that we can. And then our goal is to analyze all of this aggregated, and we'll be able to share this out then to everybody and give you an idea of what's happening and where things can evolve as well. I think the biggest thing in my mind has always been, looking to the future of these interventions, especially when it comes to coding and reimbursement, is that there is going to have to be some standardizations to them. Our medically tailored meal programs are pretty standardized. There's guidelines on how to operate those. They have the most evidence base behind them. But our produce prescription type programs and medically tailored groceries and healthy grocery type programs, those still need a little bit more research around what that is going to look like in order for it to be reimbursable. Okay, I'm going to stop there. I wanted to just pause for a minute before we end today's community of practice and see if there's any other questions that people have. All right. Well, thank you, everybody. Thank you for all the work that you do. We are here if there's any resources that you need, if there's any assistance that you need, please let us know. I'm still here. And whenever any changes happen within the Food is Medicine director position, I'll be sure to make sure everybody knows. But yeah, we will keep moving things forward, and very grateful to have you all as partners in doing this incredible work. And I'm going to continue working on money, being at the Healthy Hoosiers Foundation. So wherever I can help to do that, that is where I'm at. So, and that sometimes can be the fun part, but also sometimes the not so fun part, because it's hard and it's very competitive right now, in the food space to get funding. And so we have to really continue to bring, visibility to these programs. They are a piece of the puzzle, much like a lot of other food work. And so, continuing to recognize the impact that this does have for chronic disease management, prevention, treatment. We just have to keep telling the story. All right. Well, I hope everybody has a great Tuesday. Enjoy the rest of the week, and we'll be in touch.
Thank you so much.
Yep. See you later.
Have a great day, everyone.
You too.
Well, also, Michelle, really quick, I have a quick